Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Let us begin with a simple command. Do not treat aging as a slow disappearance. Treat it as a change in strategy. Why? Because the most useful question is not, how do we stop time? The better question is, how do we help the body and mind continue choosing life, movement, connection, learning, and purpose while time is passing? Aging is not only a biological process, it is also a behavioral process. Cells age, yes. Muscles lose some mass, yes. The brain changes, yes. But daily choices decide how much of that biological change becomes disability, isolation, fear, or loss of independence. The World Health Organization defines healthy aging not as the absence of disease, but as maintaining the functional ability that allows people to do what they value: move, think, relate, decide, contribute, and participate. That definition matters because many older adults live with chronic conditions yet still maintain meaningful well-being when their capacities and environment are supported. So listen carefully. Motivation is not a decoration. Motivation is a clinical lever. It is the inner engine that turns medical advice into action. It is the difference between knowing that walking helps and actually walking. It is the difference between receiving a nutrition plan and preparing the meal. It is the difference between being told to stay socially active and making the call, joining the group, visiting the neighbor, or stepping outside. Ask yourself, why do so many health recommendations fail? Not because the recommendations are always wrong. They often fail because they are delivered to a person, but not attached to that person's values. How can a 75-year-old maintain exercise if exercise is framed only as preventing decline? Say it differently. Say, train your legs so you can visit your granddaughter without fearing the stairs. Say, protect your balance so you can keep your own keys. Say, walk so your brain receives more blood, your sleep improves, your anxiety softens, and your day has rhythm. Now move from theory to mechanism. Why can motivation be beneficial in aging? Because it organizes behavior. It helps the older adult repeat small protective actions long enough for the body to adapt. Physical activity gives immediate benefits such as better sleep, reduced anxiety, and lower blood pressure. Over time, it is associated with lower risks of dementia, depression, heart disease, stroke, type 2 diabetes, several cancers, falls, and loss of independence. But do not merely say, exercise is good. Everyone has heard that. Say, make the first action so small that resistance has no time to build a wall. Why? Because in older adults, the barrier is often not lack of wisdom. It is fatigue, pain, fear of falling, embarrassment, loneliness, low confidence, or the quiet belief that it is already too late. Here is where motivation becomes powerful. It converts the impossible into the next step. How? First, by giving the person autonomy. Do not command an older adult like a machine. Offer choice. Say, choose chair stands, hallway walking, light band rows, or garden work. Second, build competence. Let the person feel progress quickly. Count repetitions. Measure walking distance. Celebrate standing from a chair with less effort. Third, strengthen connection. Pair the behavior with someone. A spouse, a friend, a neighbor, a clinician, a walking group, a grandchild. Research linked to self-determination theory has repeatedly shown that more self-directed forms of motivation are associated with better exercise behavior. And a systematic review focused on older adults found that enjoyment, self-determination, satisfaction with outcomes, and identity are related to maintaining physical activity. Now ask, why does identity matter? Because people do not maintain habits only because they are told to. They maintain habits when the habit becomes part of who they are. Do not say, I am trying to exercise. Say, I am a person who protects my independence every morning. Do not say, I am old, so I must be careful. Say, I am training carefully so I can keep participating. That shift is not just motivational poetry, it has physiological consequences because repeated behavior changes the body. Repeated movement improves strength, balance, circulation, insulin sensitivity, sleep, mood regulation, and confidence. Repeated social contact protects against withdrawal. Repeated learning challenges cognitive networks. Repeated purposeful action gives the brain a reason to plan, remember, initiate, and persist. And here is a detail worth holding on to. Purpose in life has been studied as a measurable health factor. In a large study of US adults older than 50, stronger life purpose was associated with lower mortality. Other longitudinal work has linked purpose with protection against cognitive decline among older adults. This does not mean purpose is a magic drug. It means that direction, meaning, and goal-guided living appear to travel with healthier aging trajectories. So give this command to yourself and to every older adult you care about. Attach every health behavior to a personal why. Why take the medication correctly? To stay stable enough to attend the wedding? Why do balance training? To walk to the mailbox without fear? Why improve sleep? To think clearly in the morning? Why call a friend? To remind the nervous system that life is not meant to be lived in isolation? Why eat enough protein if medically appropriate? To help preserve muscle? Why keep learning? To give the brain meaningful work? Now ask, how do we build motivation when the person says, I do not feel motivated? Answer this clearly. Do not wait for motivation. Manufacture it through structure. Start with one anchor habit. Tell the person, after breakfast, stand up from the chair 5 times. Or, after brushing your teeth, walk for 3 minutes. Or, before evening television, call one person or send one message. Use existing routines as rails. Aging brains often benefit from predictability, and habits reduce the burden of decision making. Next, use visible proof. Put a calendar on the wall, mark each day with a check. Why? Because the brain believes what it can see. A long chain of marks says, I am still capable of action. That visual record becomes a quiet form of treatment. Then reduce the dose, but preserve the pattern. If someone cannot walk for 30 minutes, prescribe 5 minutes. If 5 is too much, prescribe 1 minute. If standing exercise is unsafe, begin seated. If memory is impaired, use cues, alarms, family support, and environmental design. Do not shame the person for the limitation. Design around it. This is not lowering the standard. This is improving the entry point. A 2026 randomized trial in older adults with mobility difficulty found that a 4-minute daily home-based functional resistance program, including only 1 minute of lower body resistance work, improved functional performance over 12 weeks compared with usual care. The authors were careful. This does not mean 4 minutes replaces full exercise guidelines for everyone, but it does show something deeply practical. When the action is brief, home-based, and connected to daily movements like standing and stepping, older adults can gain measurable function. Now pause and ask, why is that important? Because many older adults believe the doorway to improvement is too heavy to open. They imagine gyms, machines, long sessions, saunas, and failure. But sometimes the doorway is a chair, a wall, a step, and 4 focused minutes. Tell the person, begin where your life already is. Use the chair, use the hallway, use the kitchen counter, use the phone, use the morning light. Motivation also protects aging by fighting apathy. Apathy is not simple laziness. In older adults, especially those with depression, Parkinson's disease, stroke history, dementia, or other neurological conditions, apathy may reflect changes in brain circuits involved in initiation, reward, planning, and emotional drive. So do not insult apathy. Assess it. Ask, is there depression? Pain? Poor sleep? Medication side effects? Hearing loss? Grief? Cognitive change? Social isolation? Treat what is treatable. Build a plan that is kind but firm. A recent review describes apathy as a disorder of motivation involving reduced goal-directed behavior, cognitive activity, emotional expression, and social interaction, and calls for better interventions and clinical attention. So say this: when motivation disappears, investigate. Do not accuse. How do we intervene? Use 3 channels: body, brain, and belonging. For the body, prescribe movement with safety. Include balance, strength, walking, and flexibility according to medical status. Ask about falls. Review vision, footwear, home hazards, pain, dizziness, and medications that may increase fall risk. If needed, involve a physical therapist. Make the goal functional: rising from a chair, carrying groceries, climbing steps, bathing safely, and walking outdoors. For the brain, prescribe purpose and novelty. Ask, what still matters to you? Then turn the answer into a schedule. If faith matters, create a weekly connection with the faith community. If family matters, assign a role. Reading to a child, teaching a recipe, telling family history. If mastery matters, start language practice, music, puzzles, gardening, or digital learning. Do not let the brain retire from meaning. For belonging, prescribe contact. Tell the family, do not only visit, involve. Ask the older adult to help decide, teach, choose, remember, bless, advise, and participate. Why? Because being needed is biologically different from being merely entertained. The human nervous system often becomes stronger when it is woven into other lives. Now let us address belief. What does a person believe about aging? Do they believe aging means automatic uselessness? Do they believe improvement is still possible? This matters more than many people think. A Yale report in 2026 described research showing that nearly half of adults aged 65 and older showed measurable improvement in cognitive function, physical function, or both over time, and that more positive age beliefs were linked with improvement. A related cohort study found positive age beliefs were associated with recovery from mild cognitive impairment. So give another command: clean the language around aging. Stop saying, I am too old. Say, I need the right method. Stop saying, decline is guaranteed. Say, some change is expected, but function can be trained. Stop saying, there is no point. Say, the point is today's capacity and tomorrow's independence. Why does language matter? Because language becomes expectation, expectation becomes behavior, behavior becomes biology, and biology becomes daily life. A person who believes improvement is impossible is less likely to move, learn, connect, and seek help. A person who believes improvement is possible is more likely to attempt the very behaviors that create improvement. Now make the plan concrete. Use the 3-minute motivation interview. First, ask, what do you want to keep doing that aging is threatening? Do not accept vague answers. Get a real one: driving safely, cooking, dancing, praying in community, traveling, caring for a pet, living at home. Second, ask, what is the smallest action that protects that ability? If the goal is living at home, the action may be chair stands, medication organization, hydration, balance work, and foolproofing the bathroom. If the goal is memory, the action may be sleep regularity, blood pressure control, hearing evaluation, walking, social contact, and cognitive engagement. Third, ask, who will notice and support your progress? Motivation weakens in silence. Make progress visible to someone. Then prescribe the week. Say, on Monday, Wednesday, and Friday, walk after breakfast. Every day, stand from a chair 5 to 10 times if safe. Twice this week, call someone. Once this week, learn something. Every night, prepare tomorrow's first healthy action before sleep. Make it simple, make it repeatable, make it personal, and always add medical judgment. If there is chest pain, severe breathlessness, fainting, sudden weakness, new confusion, uncontrolled blood pressure, or high fall risk, do not push blindly. Seek clinical evaluation. Motivation should never mean recklessness. It means wise activation. Let us conclude with the central idea. Aging takes away some automatic reserve, so we must replace automatic reserve with intentional design. Motivation is the design force. It makes the person move when comfort says sit. It makes the person connect when isolation feels easier. It makes the person practice when decline whispers. Why bother? It makes treatment plans livable. So command the day before the day commands you. Choose one reason. Choose one action. Choose one person to share it with. Repeat it until the body begins to answer. Why can motivation help aging? Because it turns values into behavior. How does it work? By strengthening autonomy, competence, connection, purpose, and repetition. What should we do now? Start small, start safely, start personally, and start today. Take care of yourselves, take care of each other, and let us keep growing as one family. I'll see you in the next topic.